So many misconceptions out there about this virus. We thought we would put together tonight a kind of fact or fiction report. Can you get the virus, for instance, by buying goods or shipped goods from China? Unlikely. Can you protect yourself by swallowing or gargling with bleach? No, and don't do it. Eyewitness News reporter Lauren Glassberg putting other questions to a virus doctor in New York. She's live at NYU Langone in Kips Bay. Lauren.
And Bill, a confirmed case of COVID-19 in our area does not mean that you have to be alarmist. Healthcare professionals are prepared. They knew this could happen. They knew it would happen. And here is what you should know.
So it was absolutely expected. We expect there will also be more cases in New York City as well.
Dr. Vanessa Robb is an infectious disease specialist at NYU Langone, and she is helping us quell any panic by separating fact from fiction. You should wear a mask to protect yourself from getting the coronavirus.
False. So when you wear a mask, you still get air coming in around the edges of the mask, so it's not going to protect you from getting infected.
Next, avoid the subway, because it's easier to get coronavirus in a crowded space.
False. So at this point, we're not seeing enough transmission in the United States that people need to change their daily routines.
But she says you should wash your hands after riding the subway. This will help cut down on getting germs, including colds and flu. And speaking of the flu, is coronavirus more dangerous than the flu in the U.S.?
In America right now, the greatest threat by far is flu. We've had over 18,000 deaths in the U.S. this flu season alone,
compared to 6 deaths from COVID-19 in the U.S. Next, there is no vaccine for coronavirus.
True. We don't have vaccines that we know work to prevent coronavirus, but we have vaccines in development for diseases like this.
And finally, if you have a cold or a fever, should you go to the emergency room?
Don't come to the emergency room. Stay at home. If you're not sure what to do, call your doctor, say, these are the symptoms I'm having. Should I come in and be checked? Because the last thing we want is for you to be in an emergency room with somebody who really is sick and to be exposed to that.
And one last question. Now that there is a confirmed case in the state, should you leave New York? The answer is no. 1 case, but 19.5 million people. Just keep washing your hands.